Thank you for joining us today. I will be moderating this session this morning. Can we all see my screen?
Yes, we can see your screen,
Okay.
Dr. Fuller.
Okay, so good morning, everyone. Good afternoon, good evening, wherever you are located. My name is Dr. Folarami Ogunbowale from the Division of Healthcare Management and Occupational Safety and Health, the Public Health Section, UN Secretariat, New York. Today, we are having one of our series, which is the HIV PEP kit mandatory custodian training. Not training per se, but more or less like a meeting for all HIV PEP custodian, wherever they are located, irrespective of the duty stations. And the main agenda for this meeting is for us to familiarize ourselves with what is expected of us as HIV PEP custodian, and what we need to do, how we need to do our task as HIV PEP custodian, irrespective of the location where we have. And I will be making the presentation this morning, and I will just be walking us through some of the basics of what we need to know as HIV PEP custodian. I'll be talking to us, just give us some basics of HIV, the UN HIV PEP guidelines, roles and responsibility of HIV PEP custodians, the reporting forms, and then thereafter we may have some time for question and answer. So if you have any question, we muted everybody on the call for us to have a very nice meeting, because we don't want any interruption while we're having the meeting. So if you have any questions, just drop them in the chat box. After the presentation, I'll be looking at all those questions, and then I'll be answering them one after the other. So let's start. You'll be wondering why we are going through this over and over again. The reason is because we have quite high turnover of HIV PEP custodian, because this is a role that individuals have been assigned to take. And whenever those individuals move out of the duty stations or the location, they are being replaced by a new set of HIV PEP custodian. And that is why we need to familiarize ourselves with the roles and responsibility of a custodian. Because since our last meeting, we've added a lot of HIV PEP custodian into the dashboard. And that is why we decided to be doing this training on a quarterly basis, more or less, for us to go over all those basic information again. So I'll walk us through some of the essential things that we need to know about our roles and responsibility as HIV PEP custodian. 1 minute. So like I mentioned earlier on, I'll be talking to us just to give us some basics on HIV. So what is HIV? I mean, I know most of us are familiar with the term HIV, and then why do we need to know about HIV? So HIV stands for human immunodeficiency virus. This is a virus that attacks the human immune system. It incapacitates the ability of our body to fight off infections. Even the smallest of infection that our body should be able to fight off on a normal basis, our body will be compromised and will not be able to fight off those infections, because the virus attack the immune system and render it more or less useless in fighting infection. As you know, our body has been equipped with some mechanism to fight off infection, and this is what the human immunodeficiency virus actually attacks, and it renders them useless. So that is what HIV stands for, human immunodeficiency virus. Then, when an individual is exposed to this virus, it causes a lot of symptoms and signs in the individual, which make it to form some kind of syndrome. And that is why we have AIDS, which stands for acquired immunodeficiency syndrome. HIV virus infection is what normally leads to AIDS, acquired immunodeficiency syndrome. We'll talk about this more along the course of this presentation. Like I mentioned, this interferes with our body's ability to fight infections and diseases. And that is why if an individual has been affected by HIV virus, they have all sorts of infections in the lungs, infections in the bones, infections in the brain, infections anywhere on this, any part of the body. The infection can just spring up because the immune system has been compromised. So, how is HIV being transmitted? How is this virus being transmitted? I'll just give us some of the commonest ways in which the virus can be transmitted. The first one is during unprotected sexual contacts, irrespective of the means. Once you have unprotected sexual contacts, this is one of the ways in which the virus can be transmitted because the virus, most of the time, they are contained in the seminal fluid and some of the vaginal fluid. So that is why this is more or less one of the main ways in which the virus can be transmitted from one individual to another. Most especially, one of the partner must have been infected with HIV. But if none of them have been infected with HIV, then there won't be any risk of transmission, even if they have unprotected sex. But there might be other risk of having like sexually transmitted infections apart from HIV also. So unprotected sex is one of the ways in which the virus is being transmitted. The second one, a way in which the virus can be transmitted is through blood and blood product transfusion. I mean, individual may have some medical condition that will warrant them to receive blood or blood product like fresh frozen plasma and all those other blood elements. And this basically can occur during healthcare services being rendered to the individual, especially if the blood and the blood product were not properly screened for HIV. That is another way in which the virus can be transmitted. Another way in which the virus can be transmitted is through mother-to-child transmission. This normally occurs during pregnancy, childbirth, and breastfeeding. There are ways in which this can be prevented if the individual knows that they are HIV. So the mother in this particular case must have been HIV infected. That is why how they can actually transmit the virus to their unborn child. So mother-to-child transmission is another way. Another way is sharing of contaminated needles and syringes. This is very common in those that inject drugs. And so when you share contaminated needles, let's say, for example, now I'm injecting drug, then I have another friend that is injecting drug and maybe had HIV positive. And then I use the same needle that I've used in injecting the drugs into my own system. I hand it over to another friend. And then in the process, there will be transfer of HIV virus from me because blood will have contaminated the needle that I'm handing over to the friend. So sharing of contaminated needles, especially among those that inject drugs, and also this can also occur in healthcare facilities also if needles are being shared, because some locations still indulge in these practices, though it has been a cake of reusing needles. So if they are reusing needles, this is also a risk to transmit the virus from one person to another. So these are more or less the basic ways in which the virus can be transmitted. So are there ways in which the virus cannot be transmitted? Yes. So the HIV virus cannot be transmitted through kissing. I mean, as long as the mucosa lining of the mouth are intact and there are no blood in the mouth. So through kissing, you can transmit HIV. Coughing and sneezing, eating together with somebody who has HIV, you can transmit HIV. Shaking of hands, mosquito bites, sharing of toilets, sharing of combs, sharing swimming pool, even sharing clothes cannot transmit, HIV virus cannot be transmitted. Caring for an infected person, as long as you don't have contact with their body fluid or blood, then you are protected. You can't get HIV through all these means. So this takes me to our next section of the presentation. The first part is just to give us some basics of HIV. And well, before I go into PEP, I deliberately didn't put other things on HIV, like signs and symptoms and whatever, those one will be coming up during maybe one of our other presentations that I'll be having early next year. But you know, there has been a lot of advancement in the treatment of HIV. Then people can actually live their normal life even when they are infected. But prevention is better than cure. I mean, if you are infected, you may have to be taking medication for the rest of your life. But so to avoid this, prevention is better than cure. And that is why we are having this particular meeting this morning. So PEP, what is PEP? I mean, some of us, we are new. Some of us have been here before. Some of us are new. So what is PEP? So PEP is post-exposure prophylaxis. Post-exposure prophylaxis. These are things that you do when you are exposed to a condition, a disease, to prevent that thing from happening after exposure. So that is what PEP stands for. And some people may be wondering, is it only HIV PEP that we have? We have PEP for some other conditions also. So, but today we are focusing on HIV PEP. So what is HIV PEP? HIV PEP, these are medications given after exposure to HIV virus to prevent HIV infections. So what we are trying to prevent is the HIV infections after exposure to the virus. The means of exposure may be occupational, it may be non-occupational. The role of HIV PEP is medications is actually to prevent the individual from actually getting that infection after exposure to the virus. So that is HIV PEP, medications given after exposure to HIV to prevent HIV infections. So, and HIV PEP must be administered within 72 hours window after the known exposure or possible exposure to the HIV. The reason why we have to give this treatment or this medication with or start the treatment within the 72-hour window is because studies have shown that after the 72 hours, the effectiveness of the PEP medications goes down. So that is why it's better to catch it at the beginning. The moment you know that you have been exposed, the individual must initiate the treatment ASAP within the 72 hours window for us to take the maximum benefit of HIV prevention that has been provided by these medications. The current regimen of HIV PEP medications that we are using must be taken daily for 28 days. So these medications must be taken daily for 28 days. We have received so many questions in the past that, oh, is it a one-time medication that I just take the first day and that is all? No. The current regimen that you have in our PEP kit that we recently distributed, the tablet must be taken daily. I'm talking about the antiretroviral medication must be taken daily, once a day for 28 days. So I will talk about this more in the course of the presentation also. So what is HIV PEP kit then? Because this is one of the tools that you'll be using as HIV PEP custodian, the HIV PEP kit. The kit contains a lot of items that are required for us to deliver HIV PEP interventions. So I will talk about some of these items that are contained in addition to the medications that I spoke of earlier on. So these are more or less the content of the kits that you are seeing on your screen now. Number one, the antiretroviral medications. Number two, the pregnancy test kits. Number three, the morning after pill or emergency contraception. Then number four, the UN Medical Director HIV PEP guidelines. Those are the contents of the HIV PEP kits. So the first one is the antiretroviral medication. This is the main ingredient in the PEP kit because this is the only one that prevents the HIV infection that we have been talking about, the antiretroviral medication. So the current regimen that we have, like I mentioned earlier on, is 1 in 3. I mean 3 in 1, pardon me, 3 in 1 tablet, which means when you open the bottle of the antiretroviral medication, one tablet, when you pick one tablet, inside that one tablet, you have 3 medication contained inside that one tablet. And this one tablet must be taken one daily for 28 days. The current regimen that is in circulation, the tablet has tenofovir 300 milligram, lamivudine 300 milligram, and dolutegravir 50 milligram, all formulated together in one tablet that must be taken daily for 28 days. The second component of the kit is the pregnancy test kit. You'll be wondering why pregnancy test kit. Pregnancy test kit is crucial because you don't want to administer the antiretroviral medication when somebody is pregnant you don't want to administer the antiretroviral medication for PEP when somebody is pregnant. So if you have a female colleague that is coming for PEP services, the first thing that you need to do before you initiate the HIV PEP treatment is you need to ensure that they are not pregnant. Because if they are pregnant, the treatment course will be different than just HIV PEP. That is why you need to ensure that the female colleague or client is not pregnant. So you need to use the pregnancy test kit to know whether the individual is pregnant or not. And then if the pregnancy test comes back as negative, you realize that, okay, it's negative, then this leads us to the third component of the case, which is the money after pill. This is for emergency contraception to prevent the individual from getting pregnant. That is most especially if the exposure is through unprotected sexual contacts. So you need to ensure that the individual doesn't get pregnant. That is why the money after pill or emergency contraception has been included as part of the component of the kit. Then the fourth component of the kit is the UN Medical Director HIV PEP guidelines. This guideline actually contains all that you need to know as custodian, all the patient needs to know, what the physician needs to know, all what the essential and the required information that must be available to everybody for proper administration of the HIV PEP kit. They are all included in this HIV PEP guideline. We have a section for question and answers behind different questions that have been answered there that can actually be helpful. The current kit that we circulated does not include the hard copies of the UN Medical Director guidelines. Instead, you can download the online copies. The reason why we didn't send new hard copies was because we sent out a lot of hard copies in the previous years, and the content has not really changed. But if you don't have any of the hard copies, you can always go online on the UNHR portal. We'll share all this information with you at the end of the presentation. You can always go on the UNHR portal to download the soft version of the UN Medical Director HIV PEP guidelines. Then, some of us may be wondering, why does the UN provide HIV PEP? Why can't we just, if we are exposed, why can't we just go to any of the healthcare facilities and get the PEP service for ourselves? This is the reason why the UN provide the UN HIV PEP. Number one is, it's not all locations that have access to HIV PEP from the local health providers. I mean, I've worked in some locations that you can't even talk that you are have been exposed to HIV. There are some countries that doesn't believe that HIV is legit. So in such location, you may not be able to access HIV PEP services if you are exposed either occupationally or non-occupationally. So that is why when you are working for the United Nations, irrespective of the locations, irrespective of the countries, irrespective of the context, we always ensure that you have access to this service, because we may be exposed one way or the other. So to prevent unnecessary emergencies, that is why the UN has made it mandatory for us to have HIV PEP in all our duty stations. And this UN has taken this up as a responsible employer. Then also another reason is because when a staff member is exposed, we may need to follow up to see that at least we are able to prevent them from having these HIV infections. So those are the reasons why the UN has taken it upon itself to provide HIV PEP services to personnel in different locations, different contexts where they are working. So who is eligible for the UN HIV PEP services? Because it's not everybody that is eligible or that are eligible for accessing these UN provided HIV PEP services. So the service can only be provided to all personnel that are covered under the United Nations Security Management System. So there is this United Nations Security Management System that lists the type of contract, type of individual that are covered under this UN Security Management System. And those are the individuals that are covered or that are eligible to access the UN HIV PEP services. And in locations where individuals are working for the UN and it's a family duty station and they have their family there, so any personnel and their eligible dependents are also eligible to receive the UN HIV PEP services. So the next one is the UN Medical Director HIV PEP guideline. I spoke about it briefly in my previous slides. So this guideline was developed to provide a protocol or a job aid for HIV PEP custodian, and the guidelines listed the roles and responsibility of HIV PEP custodians, the reason why the UN is providing HIV PEP, what is the roles and responsibility of the patient, what are the roles of the healthcare provider, what are the type of medication that we're currently using in the regimen, the side effect of the medications, who is eligible to take the HIV PEP services provided by the UN, what we need to do in terms of storing of the kits, the content of the HIV PEP kits. So those are the things that are contained in this UN Medical Director HIV PEP guideline. Also, we have a section of the guideline that has frequently asked questions. I mean, as an HIV PEP custodian, you'll be receiving a lot of questions from your patient or client when they are accessing the services. And because of that, we have come together frequently asked questions that custodians have been exposed to in the past. So a section of this guideline listed all those questions and provided all the answers to those questions for custodian. So this HIV PEP guideline, like I mentioned earlier on, we have hard copies in some locations, but if you don't have hard copies, you can always download this from the UNHR portal, or you can always reach out to us and we can always send you hard copies and or provide you the link to download the online version. We'll be sharing the link to download the online version to all of us after this presentation. But I will employ all of us that we should go online after this presentation because the UNHR portal may be pulled down after maybe by the end of this year, and we don't want any break in transmission. We're still looking at ways in which we can host the guideline online. This will be communicated to us, but if you need to download the guideline, you can always go on the HR portal to download it now. So, in addition to the all the content of the guideline that I mentioned earlier on, we also have the forms that we normally send with the HIV PEP kits. The current kit that we circulated does not have with the hard copies of the forms, but you can always download the form also online. And I will talk about the forms in my next slide. So whenever you are administering HIV PEP services, the forms must be completed. It is mandatory for us to complete these forms whenever we are using the UN HIV PEP services. The first form is the custodian and patient reporting form. And the second one is the physician assessment form, or maybe you can call it healthcare provider assessment form. So the first one, like I mentioned, is the custodian and patient reporting form. And the second one is the physician assessment form. I will talk about them later. So the custodian and patient reporting form. This is the first form that must be filled when a personnel is assessing the HIV PEP services. And this form has part A and part B. I mean, the form has been divided into two parts, part A and part B. The patient or the client should complete the part A of the form, because this is the part that has the basic information of the client or the personnel that is assessing the services. And also, this is where the personnel will be providing their consent that they have agreed to take this service. So that is why, as a custodian, you need to ensure that the staff member fill this part A of the form, because this is where they are giving you their consent to access the service. The part B of the form is the custodian section. You, as a custodian, this is where you put in your own information and your contact details. So when these two sections of this form has been completed, then it must be transmitted to us. For only those that are taking the services, that you have concluded that, okay, this individual must take HIV PEP. You must complete the part A and part B of the form, and then you send it to us at the email address provided on the screen, dos-dhmuch-hiv@un.org. We'll also share this after the presentation. So the custodian and patient reporting form is for the custodian and also for the patient to fill. Part A for the patient, part B for the custodian. Then, I mentioned earlier on, the part A, this is where the patient is giving you the information in terms of consent to take the service, that this is a voluntary thing. Nobody is coercing them to take the service, and that they have been the service has been explained to them, and the medication has been given to them, and so for them to be able to provide you their consent, because we need consent before we can provide this service. So the part A, you see instruction at the top here. So this is where, and it is crucial for the patient or the client to read this part before they fill the part A of the form. So they need to read the first part. I understand what the items were listed, number 1 to 6, and then fill this section below before you, the custodian, will not fill the part B of the form with your own details. Then, the second form that must be filled whenever we are using the UN-provided HIV PEP services is the physician or healthcare assessment form. This is mandatory because HIV PEP contains some medications, and that is where the UN medical director, they have made it mandatory that before you give the service to any individual, you need to ensure that an healthcare provider has conducted an assessment on with the individual that has been exposed before HIV PEP service can be given. So, because the physician or the healthcare provider will provide all the required information, they are the one that will check whether there has been true exposure to to HIV in the individual that are assessing the services before they now give their ultimatum. Okay, there has been true exposure, commence the PEP treatment, or no exposure, don't commence the treatment. That is why it is crucial for us to have a physician or healthcare assessment before we initiate the service, and that is why it is essential for the healthcare provider to fill this form once they have given their verdict that, okay, there has been a legitimate exposure, and then the individual should commence HIV PEP. So this is the physician assessment form. So which means the individual will be taking the HIV PEP service once the physician has concluded that, okay, there has been true exposure. And which means that every usage of UN-provided HIV PEP services must be reported with two forms, the custodian and patient reporting form and the physician assessment form. Inside the physician assessment form, this is where the physician or the healthcare provider will check whether there has been true exposure, what type of exposure, and then they will also check some other thing, like if there has been any infection in the past in the individual, things like that. That is why it is crucial for them to do this before you initiate the service. Then this part is where you have to pay more attention. This is where I will be walking us through some of the ways in which we should administer the HIV PEP services as custodian. So the first thing that the HIV PEP custodian must do is this. They must conduct administrative eligibility to determine if the individual qualifies for a UN HIV PEP kit usage. I mentioned earlier on that only individuals that are covered by the UN Security Management System are eligible. So it is the role of the HIV PEP custodian to check whether the individual actually falls under the UN Security Management System. Because this is the only thing. Once they are qualified under the UN Security Management System, then they are eligible administratively to take the UN HIV PEP kit. But if you check and they are not qualified under the UN Security Management System, then they may not be eligible to take the UN-provided HIV PEP services. Then, the second thing is the custodian should contact the UN physician or healthcare provider listed in the country security plan HIV PEP annex. Every duty station where you are located, if the UNDSS, they have the country security plan. And one of the annex of this country security plan is the HIV PEP annex. And inside the HIV PEP annex, they should have the list of UN physicians or healthcare provider listed and their contact details there. So the custodian must contact them for them to conduct physician or healthcare provider assessment whenever they are administering the HIV PEP kit. This is very, very crucial, like I mentioned earlier on. And in locations where you have UN clinic, you may not need to check the country security plan. You may just reach out to healthcare provider at the UN clinic to conduct the physician assessment part of the task. Then, where possible, the custodian must accompany the patient to the healthcare provider and hand over the kits, because it's not at all time that it is possible for the custodian to follow the patient. Where possible, you can follow them to the physician or the healthcare provider before you hand over the kit to them. The healthcare provider will conduct full PEP assessment and clinical eligibility before they proceed with the treatment, because this is a medical treatment. So the healthcare provider, they are the one that will conduct full HIV PEP assessment, and then they will check clinical eligibility, because it's not all individuals that are eligible. I mentioned earlier on, if somebody comes to you and you tested them and you realize that, if my colleague, they are pregnant, you won't give them the same PEP kit that we are giving now. The healthcare provider would now recommend them to take some other set of medication or refer them out for further management. So that is why it is crucial for healthcare provider to review the case with you. Then the custodian and the healthcare provider will inform the patient about all information that they need to know about HIV PEP treatment, what it means, the reason why they are taking the PEP, how they need to take the PEP medication, why they are taking it, if they miss a dose of the medication, what they need to do, if they are reacting to the medication, or if they're having some kind of side effect, medication has some kind of side effect on them, what they need to do. So that is why it is crucial for the custodian and healthcare provider to provide all the information to the individual that are assessing the services. Then the custodian will release the kit to the healthcare provider after confirming administrative eligibility and clinical eligibility that will be conducted by the physician or the healthcare provider. You may be wondering, oh, in many of our institutions, we may not have healthcare provider, that we may not be able to reach them, blah, blah, blah. So that is why the UN medical director, they have agreed that, okay, where healthcare provider cannot be reached within 72 hours window, like I mentioned earlier on, all these services must be initiated within 72 hours of exposure. So where healthcare provider cannot be reached within the 72 hours, the patient will be advised to call the Center of Excellence listed in the country security plan HIV PEP annex. This is where I was referring to earlier on. So in this annex, if you don't have the UN clinic in your location and you cannot access a physician, you can always call them on the phone. They know because they have been informed earlier. So you call them and then they will provide the assessment online. Because if you look at the physician assessment form, there are just basic questions that will be asked by the physician or healthcare provider. And once they are able to answer all those questions correctly, then they will be able to determine whether you can proceed with the administration of the kit or not, based on the information that they have gotten from the client after reviewing the forms with them. So this a type of assessment can be provided over the telephone where you don't have access to healthcare provider in your location. So healthcare provider at this center will perform a risk assessment over the telephone, and then the kit can be provided. Then the next one is custodian and patient. We complete the custodian and patient reporting form. I mentioned this earlier on. So the custodian, once it has been agreed, administrative eligibility has been checked, clinical eligibility has been checked, then you complete the custodian and patient report, the forms that I mentioned earlier on. Then you send it to us at the email shown on your screen, dos-dhmush-hiv@un.org. Then the physician or the healthcare provider that has conducted the clinical eligibility will also fill the assessment form and send it to us at the same email address. So in some instances, some of the clients or the patient, they have requested for psychosocial support. So if you don't have this in your location, if you flag it with us, you indicate it on the form that the client or the patient is requesting for psychosocial support, we can always provide this support to the individual, irrespective of where they are located, because we have a unit at the secretariat that actually provides psychosocial support for individuals that have been exposed if they require these services. So then the next thing is custodian. We need to keep up-to-date inventory of all PEP kits in their usage. You need to keep all the kits and you need to have the inventory so that you won't run out of stock of the medication, and then you'll be looking for where to get like an emergency restock. So once you have an up-to-date inventory, and then whenever you use any kit, you document it. When you need to replenish, you can always reach out to us. But this you can do if you keep up-to-date inventory of all the PEP kits that you have and all the usage of the kit. Then, in terms of care and storage of the kits, I mean, we have received a lot of questions on this in the past. That okay, where do we store the kits? My response to people has always been, if you can stay in a room conveniently, then you can store the kits there conveniently. For example, so the kits must be, you can store the kit at room temperature. Any temperature that is below 30 degrees Celsius and is away from direct sunlight or extreme humidities, you can keep the kit at room temperature and just make sure that they are not exposed to extreme of weathers. And also, whenever the kit expires, because the kit that we normally send out will expire every two years. The reason why the kits will expire every 2 years is the active ingredients, the medication inside, they always have 2 years expiration period. The shelf life for all those medications are always 2 years. And that is why we need to replace all those kits every 2 years. And that is why the kit will expire every 2 years. So when the kits expire, you can always dispose them using your local health authority guidance. or the way you normally dispose the kit or dispose any other medication that you use. If you don't know how to dispose it and then you have a UN clinic, you can always reach out to UN clinic. They will help you to dispose the medication the way they normally disposing expired medication at the clinic. And in the extreme of scenario, if you don't have access to UN clinic, you cannot dispose the medication locally. If you reach out to us, we'll always help you. I will provide you the contact of WHO colleague who will be able to help you to dispose the kit, irrespective of where you are located. So, like I mentioned, store the medication according to manufacturer instruction, which is room temperature. You keep them at room temperature, then the medication are good to go. Then, confidentiality. Do we need to maintain confidentiality whenever we are providing HIV PEP services? Yes. This is because you are receiving some confidential information, and you can, if you are a custodian and I come to you and I give you all the information, and then the next thing is I'm hearing my information from my colleague who is not a custodian, then that is more or less like breach of confidentiality. And what you are doing is you are making the service to look not reliable to other personnel, because once they know that, okay, if you try to access the service, your information will be with everybody at the duty station, then people will not come for the service. So that is why confidentiality is very, very crucial. You need to keep all the informations, all the documentation, all the forms. You need to keep them in a very safe place under lock and key. And you need to maintain strict confidentiality in terms of information. You cannot share the information of a client or a patient with even your manager. You cannot. You are the HIV PEP custodian. The only person you can share the information is the like the HIV PEP focal, like maybe the HIV PEP coordinator, because they are the one that may help you to transmit the form. That is why they may know about that. Otherwise, you cannot share the information with the your head of missions, because these are confidential informations. Please, confidentiality, very, very important. Then, do we require consent? Yes. So you need to ensure that you get a consent of the patient before you provide them the service. I mentioned this earlier on, that it's very crucial for the patient or the client to fill the part A of the patient and custodian reporting form, because this is where you have the information about consent. This part of the form, this is where you have information about the consent, that they have read and understood the guidelines, that you have explained to them about the type of services that they are taking, and that the services that they are taking is a voluntary service, and they have agreed to fill the forms, things like that. So this is where they are giving you the consent, the part A, the instruction part of the patient, custodian and patient reporting form. So that is why it is crucial for them to fill this part before you give them the service. Then, record keeping. I mentioned this earlier on. You need to make sure that you document your usage. Submit all the forms to us at the email address that we provided. Then document your usage. Keep a track on how you are using the kits. Monitor or record the expiry date of the kits. I mean, for this, you don't need to worry so much, because what we normally do for monitoring and recording the expiry dates is we always ensure that we replace the old kits a month or 2 months before they expire. So that you can discard the one that are expiring, and then you can have a new set of kits. But you need to ensure that you keep track of your usage so that you won't run out of stock of the kit. That is why a log of the kits must be kept at all time, on how many kits you have used, how many you have left, when do you need to request for replenishment of the kits. So, like I mentioned earlier on, all the forms, the custodian reporting form, the patient reporting form, can be sent to us at dos-dhmosh-hiv@un.org. Then you can download a copy of the UN Medical Director HIV PEP guideline on the HR portal now. And we also have a lot of resources that are available for download, like previous training, quick facts, patient information, some Q&A, some recorded videos on HIV, and then a video on the roles and responsibility of HIV PEP custodians. They are all available on this particular HR portal, and you can always go there to download this for your resources that you can use when you are administering the HIV PEP services. I think this is the end of my slide. I talk very fast, and I have been very careful to make sure that you get the best out of this discussion also. I will stop sharing my screen now, and this is the end of my presentation. I will stop sharing my screen, and I will go into the 1 minute. I will go into the chat to see if I have any question to answer to. Okay, the first question that I saw here is, who is the WHO focal point to receive expired kits? Are they aware of this? Yes, for this one, what you need to do is once you reach out to us at this email address, dos-dhmosh-hiv@un.org, once you reach out to us at that email, we will link you up with the individual that will be able to tell you the location where you have to send the kit to. Then somebody said, could you please clarify who is eligible to receive United Nations HIV PEP kits? Yes, if you check the UN Security Management System, they listed the type of contract of individual. And basically that I can tell you, they are direct UN hires, temporary appointment, fixed term appointment, then contracts, consultants that are working for the UN. And if they are working in duty station that is family based, if they have their family or dependent with them, they are all eligible. If you check the UND, you need to check the UNDSS security management system. That is where all the contract types are listed. That I can tell you, NGO personnel, people working for non-governmental organizations, are not eligible to UN HIV PEP services because they are not under the UN security management system. That is why international NGO personnel are not included. People that are included are people that are working for the UN. Any individual that is a consultant working for the UN, anybody with UN.org or UNICEF.org or WHO email address, IOM, UNHCR, UNFPA, IMF, World Bank, those are eligible. But anybody for working for any other non-UN organization are not eligible. Say, what if the patient reach out to custodian after 72 hours? Yes, you may still reach out to the custodian after 72 hours, but like I explained earlier on, if you want to get the maximum of prevention of HIV, if you want to get the full benefit of HIV PEP services, you need to ensure that you actually access the service within the 72 hours window, because after 72 hours, the effectiveness and the efficiency of the medication is going down. It's not that it's not going to work, but the effectiveness and the efficiency is going down. And you may need additional support. You may need to be checked more frequently. So even if it's after 72 hours, that is when the patient is reaching out to the custodian, I still advise reach out to the custodian, and then they may direct you to the clinician, and the clinician will check you, then advise you on the best course of what to take. If you need to take the antiretroviral medication in the HIV PEP kit, and then how you will take it when you come for follow-up, the type of follow-up that they will do, or the type of test that they will conduct on you. So always ensure within 72 hours. If after 72 hours you can still go, but it is not advisable for you to wait until after 72 hours before you access the services. Are there cases of seroconversion due to PEP failure detected? Is quite minimal if the medications were taken effectively and correctly. And I mean, I can't give you the percentage here, but I can share this one with us later. But some cases have been detected. But what I can tell you, PEP has more than 99 point something percent effectiveness. Yeah. Correct me, please. To request for a new set of PEP kits is to fill up form that our existing kits already expire and need to be changed to. Okay, so what we normally do is this: for you to request for a new set of PEP kits, what we normally do from our side, we based on the previous year's consumption, we know the quantity of kits that we normally dispatch to each of the countries. So either you request for the form for us to replenish the expired kit or not, we will always send you new batches of kits. The last batch that we sent out to replace all the previous kits expired in July 2024, and they have all been replaced by a new set of kits that will expire, I think, around September 2026. So if you have received the current batches of kit that we dispatched since July this year, they should still be valid until between August, September 2026. So which means you'll be receiving new set of kits to replace the expired one around August, September 2026. But if you use any kits and then you are getting out of stock of your kits before that time, you can always reach out to us and we'll always replenish any of the kit that you have used. But it can't I mean, I think somebody is trying to ask, can the kids be handed over to somebody to end use those handling rape cases? Well, those handling rape cases, most of the time, they always have a way, because that is a core part of their program. They always have a way of getting access to PEP services and prevention of other STIs in the rape cases. I mean, like I mentioned earlier on, I don't want to complicate things for us. The only people that are eligible under the UN Medical Director guidelines are those people that are covered by the UN Security Management System. But there has been cases where, I mean, humanitarian, you realize that there has been a rape case and then the NGO reached out to you. There's been a case, I mean, there have been cases where individuals have used their own humanitarian part of the UN to say, okay, let's just administer the kit, give them the kit. But they have to sign some form of disclaimer that if anything happens, UN is not responsible. We are just giving you the kit. The way you use it, you're on your own. And that is why we don't want to be responsible for whatever happened. That is why those people are not eligible under the UN Security Management System. Yeah. Okay, so somebody asked, what if the custodian is a physician? So we've had instances where the custodian, they are also the healthcare provider, which means your role is double. You are the custodian. At the same time, you are the healthcare provider or the physician. So you function as a custodian, and at the same time, you will function as the healthcare provider that will conduct the clinical eligibility. Your role as a custodian is to conduct the administrative eligibility. And once you finish that role, then you shift to the second role, which is a physician, to actually assess whether the individual has actually been exposed to HIV and if they will actually require the HIV PEP services. And which means when you are working as double, like a custodian and at the same time as a healthcare provider or physician, you need to complete the custodian and patient reporting form, and at the same time you need to complete the physician assessment form. So you can always administer the kit if you are a clinician and at the same time you are a custodian. Is there any data to show the efficiency of this service for UN personnel? Well, we have the HIV PEP dashboard, and we've received a lot of data from duty stations on individuals that have received the UN HIV PEP services, and the efficiency of the data. We actually conducted a review, I think 2020, of how effective and efficient are the services. We reached out to many custodians back then, and then we reviewed some of the cases that we have had in the past, and the result actually came out that the service is actually doing what it's supposed to do. And for example, the costs, the estimated cost of somebody having HIV and you want to get treated, full treatment of HIV is actually more than $2 million from what the review showed. So, and then by administering this medication, we are actually able to save this cost. And that is why it is crucial that UN continue to provide this service to personnel irrespective of where they are located. Okay, will you advise us to own new kits with new expiry dates sent to UNSME Medical? Well, you may need to reach out to us, the person from UNSME, you may need to reach out to us at the email provided. Then we'll check this and get back. We can get back to you on that. If you can reach out to us at that email provided. Yuan, my colleague, can you help me drop the email? Also, you can drop the link to HR Portal, and then we will share all this information with you actually after the presentation, like a copy of this presentation, copy of the forms, copy of the UN medical directors, the links to all the resources that I mentioned earlier on. So we will send all this to you after the presentation. Okay, so what do you think of including HIV rapid test, self-test in the HIV PEP kits? The thing is this, the UN medical director, they discussed this. They don't want to give too much task to the HIV PEP custodian. We need to be careful that because some of our custodians, they don't have any medical background. So we don't want to overload them with a lot of tasks and then conduct this test, conduct that test, review this test with the patient. That is why the UN medical director has not agreed to put the HIV test kits inside, for the rapid test kit inside the kit yet. And this is a deliberate thing. And also, you will not know if, for example, if I'm exposed to HIV today, either occupationally or non-occupationally today, and I come to you as a you're my custodian, and I come to you, even if you administer the test on me, you won't be able to know whether I'm positive or whether I've actually contracted HIV or not, because it's not going to show yet in me if I come to you within the 72 hours window. The only thing that the HIV rapid test would do is it will tell you whether I am HIV positive before. It will just show you that, oh, this guy is actually HIV positive already. So that is the only thing that the HIV rapid test will tell you. And we don't want to put so much information or task on the custodian. That is why the UN medical director has not included these services. Then I know I was actually expecting a question, but nobody has asked the question yet. We always get this question: why is the UN not providing PrEP to individual UN personnel? For now, the UN medical director, they are not in support of the UN providing PrEP to duty stations like we are providing HIV PEP kits. Instead, if you need to take PrEP as a UN personnel, you can always reach out to your own physician and then check with your UN insurance if they will cover PrEP, and like that, many individuals that have been assessing PrEP, they are only assessing it through contacting their own personal physician and then their insurance covering the PrEP. And also, another reason is because PrEP has some very specific criteria for us to access it. So that is why the UN is not providing PrEP now. We are only providing PEP. Maybe in the course of next year, we had a presentation on PrEP, which is pre-exposure, not post-exposure that we're dealing with. Now we're dealing with post-exposure, PEP. So we had a presentation sometimes, I think, a year and a half ago. Maybe sometimes next year, I'll bring one of our consultants to talk to us on pre-exposure prophylaxis, what it contains, who are the individuals that are eligible for PrEP, pre-exposure, before exposure. So, I mean, basically, in many of the stringent health authorities, one of the main criteria for PrEP is for discordant couples, like maybe the husband is HIV positive and the wife is HIV negative, and then the wife will be taking PrEP. So, and it has been shown to be effective. So, but during the course of next year, we will bring one of our experts to come and talk to us about PrEP also. Somebody said, is there any situation where the PEP kit should not be provided? So the reason why for this, the answer is yes. There are situations where PEP kit cannot be provided. And most of the time, for example, I mentioned something earlier during the course of the presentation. If you are pregnant and you're trying to access HIV PEP service, you may not be eligible to take some of the medication that we have inside our own current PEP kit now. That is why it is crucial for them to check whether you are pregnant, or if you know that you are pregnant, you tell the custodian, then the physician, they will review. And then instead of taking our own PEP, they may refer you for a much more definitive treatment that will not harm the pregnancy and that will still prevent the infection and in you, and also prevent mother-to-child transmission of infection. Also, there are instances where individual cannot take some component of the HIV medication inside the HIV PEP kit because of the current condition. Like, for example, some people have some kind of liver problem, for example, and there are some medications that are hepatotoxic, which means they will harm the liver. So that is why the physician assessment is very, very crucial. Those are some of the things that they will check to see whether you are clinically eligible. And there has been instances of allergies also. So it's very, very crucial to check so that they will see whether you are eligible before they administer the kit on you. Somebody was trying to ask a question, the case, but I didn't try to about the case should be only to give the case. I didn't get the question, so sorry, I'm not going to read this because I didn't get the question. Okay, somebody said we will not give emergency contraceptive drug if pregnant test is positive, but what type of HIV medication we give to those patients? That I explained this earlier on. If the individual is pregnant, the clinician or healthcare provider will definitely manage this for you, and they will refer them higher up for proper management, because what you need to make sure that you use a medication that will prevent the HIV infection in the mother to be and also in the child. So this individual, whoever is pregnant, we need further assessment to determine the type of medication that they will take for their own PEP. Well, so compliance is important. However, individuals may find it difficult to take the meds at home for either disclosure reasons or cultural norms. Well, for this, I mean, it's kind of you are right to some extent, but for somebody to access you to come to you that they want to prevent HIV infection, they must have weighed the pros and cons of this actually. Whether you want to either for disclosure reason you want to have HIV or norms. I'll give you an example. There was a case of a custodian that reported to me that an individual came to this clinic. They've conducted the HIV PEP custodian services, and then they conducted all the reviews, and then they realized that this individual is clinically eligible. This individual has actually been exposed, and the individual is eligible to take the medication. They check and they realize that, okay, the med is not going to have the side effect or whatever. They gave the medication out. They explained to him how to take the medication. Then this individual went online, started googling the name of the medication and looking at the side effects. So he came back to the clinic that, guys, this medication have a lot of side effects. And the custodian told the client that, I'm sorry, but that is the medication that you have to take. We have conducted the clinical assessment. You haven't even started taking the medication. You are worrying yourself about the side effect. So you now decide whether you want the side effects or you want to prevent HIV. I mean, you have not even started taking the medication. You are worrying yourself about the side effects. So, I mean, we need to weigh the pros and cons. The compliance will always be not 100%. In fact, there have been instances of people not missing doses of the medication. That is another thing that you'll be facing as a custodian. They may be reaching back to you that, I missed a medication. What do I need to do? So those type of questions, if you go in the UN Medical Director HIV PEP guideline, we have details, responses to most of the questions on issue of compliance, what to do if individual miss a dose, etc. Somebody said the pregnancy test might be negative at first, but some days later it might change. Does the orientation change? That is why if you check the physician or the clinical assessment form, there is a section for follow-up there. And this is where the clinician or the healthcare worker comes in. They will have asked all those questions to review with the client to see what the possibility of getting pregnant. They will have asked them a lot of questions if they have missed their period and etc., things like that. So, I mean, those are well covered in the physician assessment form, actually. Someone say in case of sexual assault, the staff need it but might find it difficult to take the medication at home. Yeah, I mean, it's not necessary for you to take the medication at home. I mean, if you can take it in the office, why not? You can take it in the office. You can just decide that, okay, all my medication I'll be taking when I get to the office first thing in the morning. I mean, there is a way around this. I mean, it's not, I don't think this is difficult in terms of, except if the individual has decided not to be compliant. Like, for example, now, if you give me a medication and you tell me that my life depends on it, irrespective of where I'm located at home or whatever, I will find a way of taking the medication. I'll give you an example now. Let's say an individual that is taking PrEP, you know that you want to have unprotected a sexual contact with your wife who is HIV positive, or your husband who is HIV positive. And you just need to make sure that you take the medication. So we just need to look around ways of making it easier, and that is why you also need to discuss with the client when they are assessing the services, if there might be challenges with taking the medication at home, how you will take the medication, etc. So I mean, you can work around this with the client. So what is the minimum age to be treated? You can treat children and you can treat adults, but our current medication are specifically targeting, I would say, children that can swallow tablets and above. We don't have the pediatric formulation yet. The UN Medical Director has not been sending out pediatric formulation yet in our HIV PEP kits, and that is why if you access the clinician, they will be able to refer you And we may also be able to intervene if there are cases that there's a child that is exposed that is not able to take the medication inside our PEP kit. We may be able to liaise with agencies within the duty station to see if they can actually provide access in terms of medication that the child can take. There are some questions here that I didn't really get. Okay. I can see that Dr. Brand mentioned I've come across staff who are repeated offenders. They keep coming back for PEP, refer for PrEP after extensive counseling. Yeah, I mean, we have individuals that will keep coming back. And when you see an individual keep coming back for PEP, then it means especially if it is occupational or non-occupational, you need to actually do proper counseling on HIV prevention to them. Because if an individual is coming back, if they keep coming back like that, the probability of actually getting HIV is very, very high because of some careless moment. And so for repeat offender, like I'm reading in the chat, you may need to do proper counseling on HIV prevention to them before you administer the service, or you refer them for PrEP or for other, like Dr. Brown mentioned, you refer them for extensive counseling. This is very, very crucial. It's not, if somebody is a repeat offender, it's not about the medication again, it's about proper counseling. If you counsel them properly, that's when they will know the risk. It's like anytime they keep coming back, they are exposing themselves to risk of actually having HIV. So somebody asked, in the security plan, the physician should be designated as UN physician, or this can be any doctor. It should be UN designated physician, or it can be any doctor on one condition. There are some duty stations, what they have done, they don't have UN designated physician, but they have made some kind of contractual agreement with some particular clinic who will be conducting the assessment for them. So if your case is like this, then it could be any of those doctors. And it cannot just be any other doctor. It must be a doctor that you have previous discussion with, that anytime we have a personnel coming down with exposure, we'll refer them to you to do this type of service, because they need to fill the form also. There is a responsibility for these doctors. It cannot just be any doctor. It has to be a doctor that you have spoken to before and they have agreed to provide this service, and then they will have also agreed to provide confidentiality of the information that they receive. I think that is all for now. Thank you very much, everyone. If you have any question, you can always reach out to us on our email address, and we'll be able to provide additional support if you require. I don't want to take so much of our time. I overshoot our time already by more than 19 minutes, and it's because I want to answer most of the questions. So if you have any questions, please let us know. We'll be able to provide support. And also at the same time, we'll be sending a copy of the presentation to all of us, and then a list of the other resources that I mentioned during the course of this presentation. So thank you very much, everyone. Dr. Brand, thank you. I appreciate your comments on the chat also. Thank you very much, everyone. Have a nice one. Bye-bye.